For our project, we did dental caries and ergot poisoning. Dental caries are a bacterial infection that put you more at risk for oral cancers, and the primary causative agent is Streptococcus mutans. Streptococcus mutans can be characterized as a gram-positive lactic acid-producing bacterium arranged in pairs or chains. It produces capsules made of polysaccharides that stick to the teeth, and the bacteria feeds off the fructose and sucrose to fuel their metabolism. The glucose produces lactic acid, which works to break down the enamel, resulting in tooth decay. It doesn't have any flagella or endospores. Streptococcus mutans may be spread by saliva, whether that be most often vertically or horizontally from transmission. Most frequently is spread from mother to child or caregiver to child, which is a vertical transmission, or between family members, which is a horizontal transmission. Another way for S mutants to spread is throughout someone's own mouth, because this bacteria forms biofilms and then the cells break apart and colonize in other parts of the mouth. It can also be triggered to form from someone's own mouth by the bacteria breaking down, and the sugars produce acid as a byproduct. This acid then attacks the tooth enamel, causing a loss of minerals and a weakening of the tooth structure. And the longer the acids are in contact with the teeth, the more extensive the damage can be. Ergot poisoning is a fungal infection that targets the circulatory system, which is responsible for transporting blood, oxygen, and nutrients throughout the body, the nervous system, and the integumentary system, which is the skin, hair, and nails. The typical causative agent of ergot poisoning is Claviceps purpurea. It is a fungal with a variable morphology. Most often it appears as an elongated, straight or curved, with black to purple bodies that emerge from glumes. The size varies depending on the size of the seeds, and the rinds can vary from hard, rigid, or wrinkled. Looking at the cellular structure, it is noted to be found with hyphae, which often develops a structure called a sclerotium. Within the sclerotium, the cells are mostly in a cuboidal shape and contain lipid vesicles, primarily functioning as the production and storage of ergot alkaloids. Claviceps purpurea can only affect the ovaries of grasses, leading to cross-pollinated crops to be the most likely to be infected. The bacteria survive in harsh environments, typically tropical because of their sclerotia. This sclerotia is ground up with rye grain and is seen in wheat, rye, animal feed, and seeds. This being said, if the sclerotia is not removed, it can be ingested by people or animals through the contaminated grains. Some examples of common foods that are infected are rye, wheat, barley, and oats.
For dental caries, there's different layers that can be reached in a tooth. So the further the area that is affected, the worse the signs and symptoms become, and then that's when action will need to be taken. So a person can experience, in the mild stage, bad breath, bleeding, gums, and swelling in their face. And then there also comes toothaches, so there's tooth sensitivity to hot and cold foods, and then difficulty chewing when eating certain foods, biting down. A person will also experience pain in their jaw and then even their ears, because all the nerves and muscles are connected. For ergot poisoning, the signs and symptoms include nausea, vomiting, lightheadedness, numbness, and tingling, hypertension, bradycardia, muscle pains, and itching. If a person overdoses on this type of bacteria, there could be acute vascular spasms, thrombosis, and hallucinations. The route of transmission for dental caries is due to a carcinogenic bacterium, which is primarily Streptococcus mutans, and then this metabolizes sugar to produce acid, demineralizing the tooth structure over time. For ergot poisoning, the route of transmission is basically ingesting grains, so typically rye, and then normally it's been infected by a fungus called claviceps purpura, and then the infection replaces individual grains with dark, hard ergots that get mixed into healthy grains during harvesting and milling. Type of treatment available for dental caries is fluoride, and that just repairs the enamel, and then also a person can get fillings done, so that's when a dentist drills holes to get rid of the infected area so it can no longer spread. A more serious one is a root canal that somebody can get, and that removes the pulp of the tooth and then refills the tooth. And the last resort is tooth extractions, and then that's just removing the whole tooth. For ergot poisoning, type of treatment available, first they would run a scan, an x-ray of your blood vessels to see if there's narrowing, and then narrowing of the blood flow. And then your doctor will stop you from taking any medicines that contain ergot alkaloids that could possibly give you intravenous or intra-arterial infusion of medicines that relax blood vessels to treat the ergot poisoning.
Dental care is a global and historical perspective. Currently, 90% of US adults over 20 years are being affected by dental caries, and globally, we have been affected greatly. Even kids themselves are also being affected by tooth decay. And how has this affected us historically? In the medieval England era, only 8 to 10% of people had dental caries. Recently, this has been improved in the society as oral health has also been introduced in the society today, especially in developed countries. This was due to better dental hygiene habits, fluorides being introduced in water, and also the introduction of toothpaste and also access to dental care has also been introduced into the society today. Who and where were more likely to be affected by um, dental caries. People were less likely to be affected by dental caries in the past as there were less sugar diets then, and this was mostly before the Industrial Revolution. And now we're more likely to have dental caries as we have um, more high sugar-based products and also more food processed are being introduced in developed countries, and also in developing countries we have less access to dental care and education. Who are who are most likely affected? Kids are most likely affected as they have higher chance to consume sugar diets and develop teeth. Older adults are also likely to be affected by dental caries as they have more chances to have receding gums and also dry mouth for medications. We have higher chance of dental caries in African Americans, the Hispanic, and also the indigenous people. Lower income countries also have higher chance to have tooth decays as they have poor dental care access and also low hygiene education. Eugotic poisoning. This occurred in France in 99 AD time, and this killed over 40,000 people. This was due to the poor grain storage and milling process then, and it is currently known as the St. Anthony Fire, as this was due to the burning sensation the victims felt, and having been treated in a religious hospital, it was named as this. Egotism is very, very rare now as we have better modern day technology, and also we have good safety um, regulation now. This has declined as we have better farming practices, which has reduced fungal growth in crops. And now we also have improved grain storage and also cleaning techniques, which has reduced the contamination of crops, and also good safety regulation and food safety inspection has also reduced the outbreak of gigotism in society today. This was mostly common in the past in Europe and also the northern part, mostly in areas in the rural areas where there were damp and also cool areas. This is mostly common in areas which have um low food safety regulation and low modern day harvesting, and also lack of drying and storage techniques. These are mostly found in areas like Ethiopia, India, and also in Nepal. Kids and also younger generation are most likely to be affected by eugiotic poison as they have much smaller body size and also weaker detox system, as they are more likely to be vulnerable to even smaller doses. Older adults are more likely to be affected as they have a slower liver and kidney function, which can delay toxin removal. Outbreak case study, the dental caries and also the eugiotic poisoning. In 1951, a point is sent a spirit from outbreak that occurred in France that affected 250 people, which was caused to the contamination of bread, which caused most of the victims to experience hallucination and convulsion and led to the death of some of the victims. Treatment the treatment they had was seduction and amputations. This also caused long-term neurological damage to most of the victims, and this outbreak led to France to tighten their food safety laws, and this has led to less occurrence of eugiotic poison in France. And also a case that happened in the northern part of Philippines found that 59 to 92% of kids around the age of 2 to 6 had untreated cavities, which led to very severe pain and infections. And this led the government to introduce an after-based school program to teach younger generation on oral hygiene and how this oral hygiene can be improved on their health. Okay. Ugatis poisoning is linked to the discovery of LSD as scientists extract alkaloids from the eukaryotic fungi, which has led to the creation of LSD. Saliva also plays a important role in um, neutralizing acid and washing away fruits particles and also providing minerals like calcium and phosphate.